say to that single pregnant woman who might have AIDS, no income, and she needs Daraprim in order to survive? What do you say to her when she has to make that choice? What do you say to her?
On the advice of counsel, I invoke my Fifth Amendment privilege against self-incrimination and respectfully decline to answer your question.
Unbelievable. Martin Shkreli there, who was called the most hated man in America when in 2015 he raised the price of a life-saving drug 5,000%. A crucial pill, once costing $13, suddenly overnight $750, a single pill. Well, he was jailed last year, not for that cold act of capitalism. That wasn't illegal. He was jailed for fraud. But even in prison, the 35-year-old is reportedly using a contraband mobile phone to run his old business. Now, in a moment, we'll hear from three people who've all interviewed Shkreli, his biographer, who visits him in jail, an award-winning journalist who knows the pharma industry inside and out, and an HIV-positive activist who actually admires him. But first, why do so many people hate Martin Shkreli? Take a look and judge for yourself.
One tablet of Daraprim used to cost $13.50. The drug maker recently increased the price to $750.
32-year-old former hedge fund manager Martin Shkreli thought the drug Daraprim was underpriced.
The so-called Pharma Bro raised the price of an HIV drug by 5,000%.
It's a free market, and it's up to each company to decide what price is proper.
These guys get away with murder, and it's time we stop them.
It's incredible what greed can do to you.
That is bad actors making a fortune off of people's misfortune.
He looks like a spoiled brat.
No one wants to say it. No one's proud of it. But, this is a capitalist society, capitalist system, and capitalist rules. And my investors expect me to maximize profits, not to minimize them or go half or go 70%, but to go to 100%.
So this guy, he apparently doesn't have a conscience about this, and he's going to keep on going.
You see how greedy this move looks.
Yeah, I could see how it looks greedy, but I think there's a lot of altruistic properties to it.
In what way?
With these new profits, we can spend all of that upside on these patients who sorely need a new drug, in my opinion.
These companies jacked up the prices, took as much money as they could out of the pockets of patients, and put those funds into their own coffers. It's not funny, Mr. Shkreli. People are dying.
Do you think you've done anything wrong?
I invoke my Fifth Amendment privilege against self-incrimination and respectfully decline to answer your question.
In response to all of this attention and doctors and patient groups saying they can't access this drug, are you going to change the price?
No.
We turn now to who many are calling the most hated man in America.
He's known for one thing, the Pharma Bro stuff, but this is something different altogether.
Martin Shkreli found guilty of lying to his investors.
What the feds called a web of lies and deceit.
Pharma Bro has been found guilty of 3 of the 8 federal charges.
Securities fraud, and conspiracy to commit securities fraud. These aren't little matters.
He was crying before the sentencing, Trish. He was crying during it. He was whisked away really quickly after it. 7 years for so-called Pharma Bro, Martin Shkreli.
Well, 7 years in jail. Let's start there. And his biographer, Christy Smythe, who visits him regularly. Christy, let's start with this. How is our millionaire Pharma Bro doing in prison?
Well, he is surprisingly doing quite well. I think one of the frustrating things about trying to punish the Pharma Bro is that whatever situation you put him in, he'll make the best of it. And even in a low-security prison, not a minimum security prison, mind you, but somewhere with some violent criminals and so on, and less freedoms, he's managing to spend a lot of time reading and studying medical journals.
This is the young man who annoyed a nation. How is he doing in prison? Has he many friends? Has he made enemies?
Friends, yes. Perhaps enemies. It's very polarizing, obviously. But yeah, he has friends in there.
What kind of friends? You mentioned to me in our conversation before, some of them were quite tough characters.
Yes, people convicted of major drug crimes, one in jail for 25 years. Yeah, he has learned, I think, through his own experiences, how much the prison system in America is focused on drug criminals who, it's really a sad thing, honestly.
He's in prison not because he raised the price of that life-saving pill, but because of fraud. Can you just explain that?
Yes. In addition to jacking up the price of drugs, he had these hedge funds. He had also launched a drug company. He lost money in the hedge funds, and his way of trying to save that situation was by starting the drug company, and he paid people with money, consulting agreements and settlement agreements from the drug company. All of this led to fraud charges, charges of securities fraud for lying to investors in the hedge funds, and additional charges, which he was not convicted of, for taking the money from his
Is he
drug
working
company.
out?
People are in jail for that. He's trying to.
Yeah?
He can do 15 push-ups, supposedly. He's been doing planks.
Making the best of it. And apparently he plans to come out and be richer than ever.
That's his hope. Yeah, he's been doing some of the research he's been doing and looking into medical journals. He's forwarded along to his company and said, here's some interesting opportunities you should consider. And I think some of them have played out. And it's very exciting, interesting stuff. I'm hopeful for him that it works out, because this is actual research and things that could actually impact people's lives in a positive way.
Christy, thank you. Let's bring in Bethany McLean now. She interviewed him several times for her Vanity Fair article published in 2015. And before we talk about that interview, Bethany, let me just ask you about the pharma industry in general. Why is it not illegal to jack up the price of a drug by 5,000%?
Because there's a belief that the free market should set the price of a drug. And for a long time, the system almost worked with this kind of implicit moral code, which was that pharma companies just didn't. And they did things that were in the interest of society as well as in the interest of their bottom line. Merck famously helped supply a pill to help blindness with kids in Africa for very little money. And then that, as our world became increasingly capitalist, that went away.
Bethany, why didn't another company just come along and make a generic version of this pill, Daraprim?
Because you have to be able to get FDA approval from the regulator to say that the drug is equivalent. And in cases like Daraprim, two things can happen. One is that the company that owns it can keep a tight control over the manufacturing such that it's hard for somebody else to prove equivalence. The other thing that can happen is just a pricing issue, right? The company that originally jacked up the price can also lower it and then suck the profits back out. So for somebody else to invest the money in getting this regulatory approval, they have to be pretty sure there are going to be profits left to capture.
Now, Martin Shkreli was originally a fund manager, hedge fund manager, and he targeted Daraprim for a reason. He obviously spotted something there. What was that?
What he spotted is that that's the only option for people who are otherwise going to die. It's a really important drug, and it's the only one that's available. And so his argument was, well, people either have to get their hands on this or they're going to face really dire consequences. So it's not like there's an alternative, and that was one of the really important things about Daraprim. It served a very narrow patient population. It's what's known as an orphan drug, but the people who need it don't have an alternative. Therefore, you have a lot of pricing power.
Thank you, Bethany. Let's bring in our final guest now, Josh Robbins, who is himself HIV positive and is a healthcare campaigner. Josh, Bethany was just explaining there how important this drug is. It's a lifesaver. In what circumstances do people need this drug?
Yeah, so Daraprim is indicated for the treatment of toxoplasmosis, which is a parasite infection, and it can also be used as a preventative measure or drug for toxoplasmosis. But it's not only for people that maybe have an AIDS diagnosis, it can be anyone with a compromised immune system, like pregnant women and patients that have gone through cancer treatment.
You, like many other people, hated Martin Shkreli. Then what happened?
I'll tell you, I reacted just like everyone else did on social media because the story was very specific, and it said that patients particularly, and somebody, that patients weren't getting access to the drug and that they were dying. That is obviously very, that's not cool.
So what did you do about it?
I did react to that. Well, I started looking into it, actually. So I started looking into past what the media was saying, and I started looking for stories of these patients that were dying or having access issues, and I couldn't find it. But I just decided to direct message Martin on Twitter, and I asked him if I could have an interview. His reply was sure, and then a week or two later, we were on camera. We did a video interview. He was in the backseat of a car, and I thought I would get to talk to him for 10 or 15 minutes. He ended up talking an hour. I scooped national news because he gave me the price reduction and the date by which it would be reduced.
Yeah.
When are you going to lower the price?
It's a good question. I think pretty soon.
And it didn't really, that didn't happen. But there was something that did happen. He cut the price, or he cut the bottle size in half for hospitals.
I got you. So you scooped the big networks. You got him to commit to a price reduction. He didn't reduce the price. What he did, very intelligently, is he actually reduced the quantity of the bottle he sent out to hospitals and charged them the same.
Yeah, but that's really important for the regional or rural hospitals in America because they can't afford to keep, with this, toxoplasmosis only affects like 2,000 patients a year. And so hospitals everywhere don't need that large quantity, the whole bottle for a potential patient. So I think that, he was trying to compromise. But, at the end of the day, Martin had a responsibility for making sure patients got the drug, which they did. And then also he has shareholders that he had to maximize profits for,
which
he did.
Thank you, Josh. Well, Josh alluded to Martin Shkreli's defense. Here's his actual defense in his own words.
We've put the right protocols in place to make sure, in fact, that patients get the drug faster and with almost no cost. Half of our drug we give away for $1. And if you can't afford the drug, we'll give it away totally for free. I'm really excited to develop new drugs for toxoplasmosis. We're going to contribute the majority of our revenue to doing that.
In your experience, what is the most effective way of keeping patients' out-of-pocket expenses low?
Insurance.
Insurance under the way it is now,
Yeah.
Affordable Care Act?
Yeah, absolutely. Employer insurance renders copay assistance at a limited price, and then Affordable Care Act renders copays at extremely low prices. No one can't afford Daraprim, for instance.
Back to Josh for just a moment. Josh, when he was in front of Congress, they were saying, people are dying, Mr. Shkreli. This isn't funny. Did anybody die?
I haven't been able to find any story of any patient dying because of access to the drug. And furthermore, I think that it's really appalling to me that the media continued to allow that story to be told because I couldn't find it and I still haven't been able to find it years later.
He told you and others that if people really couldn't afford it and they didn't have insurance, they could simply write to him and he would give them medicine for free. Is that right? Did that happen?
Well, yeah. I mean, that's what he told me, and he gave, I think, one instance. I mean, I don't know the specifics of all of that, but I do know that I haven't read a ton of stories of patients not having access to the drug, and if they have access, then they are finding a way for it to be paid for, and probably that's from insurance. And I'll tell you, yesterday I got a brand new HIV drug prescription. The sticker price of that bottle for 1 month was nearly $4,000. I have insurance, also have copay assistance, just like Martin talked about. I paid $0 yesterday for an almost $4,000 bottle of medicine.
Josh, thank you. Let's go back to Bethany now. It's an interesting point that Josh raises. If you have insurance, there's no problem. Is there a problem?
Well, there is a problem in the sense that there's no such thing as a free lunch, right? It's a basic rule of economics. So if we're all the cost is getting absorbed somewhere in the system, if a company is making whatever you want to term it, excess profit somewhere. And then there are the people who are outside of the insurance system who don't have access to it, who need the drug. And Josh is right, there is a way to get the drug to those people, but there are also cases where people can't have it. And I would point to a company called Valiant, which was also raising the prices exorbitantly on drugs that people needed to stay alive.
The thing is, Bethany, he said that he used the excess profits, if you like, to plow it back into the company's research and development and find a better drug for these people, and he literally said to help dying and sick children. It sounds a beguiling sort of strategy. Is that what he really did, though, with the money?
Well, we never got to find out because he got kicked out of Turing and then was on trial for the stock scheme, and so we never got to find out what he would have done. I was torn. I didn't know. I spent a decent amount of time with him and at his company's offices, and I didn't know whether to believe him or not. And I thought the proverbial proof was going to be in the pudding. We were going to have to see what he did. I guess I probably would have believed him.
So what's happening now with Daraprim, the drug that we're talking about? What's the price of that now?
Yeah, it hasn't gone down. Yeah, it is. It is. It's the same.
There's a rule in this. Once the price goes up, it doesn't go back down. Valeant famously promised in front of Congress that they would reduce the prices on their drugs, and they have not either.
Okay. You were in a very big Netflix documentary talking about Valeant, a very important company in the pharma industry, have also got a record of targeting companies and drugs purely to make money. This is a big problem?
Yes, it's a huge problem. And you could argue that on the really big drugs, the multi-billion-dollar drugs, where the big pharma companies raise prices by double digits annually, that takes much more of a bite out of the healthcare system than anything that Martin Shkreli did. So I always found it really ironic that everybody targeted him as the problem, when in actuality, he was just the canary in the coal mine, showing what was already going on.
Okay. Thank you, Bethany. Well, it wasn't just raising the price of drugs that made him a hated figure. It's also how he smirked and smiled during questioning before Congress.
I know you're smiling, but I'm very serious, sir. You can look away if you like, but I wish you could see the faces of people, no matter what Ms. Retzlaff says, who cannot get the drugs that they need. And I truly believe, are you listening?
Yes. Back to his biographer now, Christy, who visits him in jail around once a month. Christy, did you ever ask him why he portrayed himself like that in Congress?
Portrayed is an interesting question when you're talking about Martin Shkreli. He exists a little bit in his own little bubble where he doesn't really take into account how people view him necessarily. I think it was kind of a shocking experience for him during this whole trial and the drug pricing controversy to suddenly realize that other people saw him in ways he did not see himself. So the way he reacted, from as far as I know from talking to him at that time, was he was just so frustrated by being called in front of Congress. He had offered to speak to them behind closed doors. He had made many offers and made Nancy Retzlaff available to talk about the company, and they still demanded his appearance, even though they knew he would only be able to plead the Fifth because of his other legal proceedings. So he saw himself as just a punching bag for lawmakers, and he just found the entire proceeding to be ridiculous, Christy, which is quite obvious.
Christy, he looked rather disrespectful and certainly dismissive of politicians. Mr. Cummings, for example. Does he actually hold them in low esteem, and if so, why?
Yes, he dislikes most politicians. He finds them to be, grandstanding, mostly out for their own image, and not usually focused on actually fixing problems.
Oh, well, he is normal in some regards, then. Well, that's just one sample from one congressional hearing. Over his relatively short career, he's annoyed and upset a raft of famous people, from politicians to rappers.
Just as things were heating up between Republicans and Democrats during the 2016 election, Martin Shkreli couldn't resist stirring the pot even more, making a $2,700 contribution to Democrat Bernie Sanders. But Bernie wasn't feeling that and sent the money onto a Washington health clinic instead. And Sanders even called Shkreli the poster child of greed. Ouch. Shkreli was found guilty of fraud in August 2017. But while awaiting sentencing, the ever-diplomatic Pharma Bro had his bail revoked for posting a $5,000 bounty on Facebook for a single strand of Hillary Clinton's hair after she criticized his price hike.
There's no excuse from going from $13.50 to $750 for one pill.
Shkreli said it was satire, but the district judge wasn't laughing and sent him to prison, claiming the post was solicitation to assault. The Pharma Bro also made enemies in the music world. The popular hip-hop group, the Wu-Tang Clan, held an auction for the one and only copy of their album Once Upon a Time in Shaolin in 2015. Shkreli was the highest bidder at $2 million, making it the most expensive individual album ever sold. Wu-Tang Clan's Ghostface Killer wasn't impressed.
This is him. Check his face out, man. Carved out nose, everything, you know what I'm saying? Walking around with fake goons like he's tough and he ain't got a real bone in his body.
And you're trying to reclaim the spotlight from my spotlight. That's not going to work, Ghost.
Sadly for Shkreli, a judge ordered the album to be forfeited in 2018 after Shkreli's assets were seized following his conviction for fraud. Shkreli managed to get banned from Twitter in 2017 by harassing the journalist Lauren Duca after she wrote an article criticizing President Trump.
Martin has been trolling me, tweeting at me that he wants to date me, and I don't know if he has any part in this, but people have been messaging me that I should sleep with him.
He even sent her an invitation to attend Trump's inauguration with him. Duca's reply, "I'd rather eat my own organs." Twitter wasn't amused, banning Shkreli from the site. And when the most hated man in America went on trial in 2017...
How guilty are you?
How did they pick a jury made up of people who, well, didn't hate him? How could he get a fair hearing? Transcripts from the jury selection show that it was pretty hard. One potential juror said he saw Shkreli and thought, "That's a snake." Another called him a greedy little man. And another said he couldn't give him a fair hearing because he had disrespected the Wu-Tang Clan.
Little unfair on snakes. Anyway, let's go back to Bethany, who interviewed him multiple times for her article. Bethany, in your article, it says, "I'm not that guy." Is there another side to him?
I think there is another side to him. That echoes Christie's point. People, he liked to play games with how people perceived him, and he struck me as very naive in some ways. He didn't realize that what he thought were little games he was playing with perception could actually become reality. And he had no real sense of the interplay between those things, and so he'd think he was doing something funny and that people could clearly see through it to know that it was a farce or that he was poking fun at the system. And he didn't get that most people's sense of humor didn't work that way.
Quick line from your article here. He's such a perfect villain when viewed from afar that it's almost impossible not to like him more up close. What's likable about him then?
Well, there's a side of Martin that was very passionate about drug research and about trying to use the profits from this drug to cure rare diseases and to make sure that people who didn't have alternatives could have treatments. And he came across in person, particularly in his office, as a very passionate and well-intentioned young CEO. And a lot of the people he had working for him actually believed that was the case.
Chrissy, I want to come back to you for a moment. I know that you're nodding your head there in agreement with all that. I want to ask you specifically, though, this little shenanigan he did where he said, "I put a bounty on Hillary Clinton's hair," that actually cost him very dearly, right? Why does he hate Hillary?
He hates Hillary because he sees her as a villain of the drug industry, or as an antagonist of the drug industry. And I think he felt personally attacked when she, in fact, did go, when she mentioned him as in part of her campaigning. As a white collar criminal, it would have been pretty easy for him to go to a minimum security prison camp, which would be relatively easy to live in. You could self-surrender, so no one's taking you away. But because he made this post after he was convicted, prosecutors said he represented a danger to public safety. His bail was revoked, and he was sent straight to the Brooklyn Metropolitan Detention Center, which is not a fun place to be for anybody.
Fair enough. Well, Martin Shkreli is often accused of being a spoiled little rich kid, but actually his parents were janitors, immigrants from Albania and Croatia, who set up in Brooklyn, and the intelligent young Martin won a scholarship to a posh school in Manhattan. And he's keen to let everyone know his humble background.
Are you a privileged, entitled?
No, come on, man.
Break it down for me.
I'm from Brooklyn, New York. I was born in Brooklyn, privileged. No, my parents are janitors, dude.
I read.
My parents, to this day, my mom still does that. She's making 50 grand. This is not a privileged family. I grew up in the streets.
Back to Christy. Christy, it's important for him that everyone knows he came from nothing, right?
Yes, it is important for him. I think it's part of the reason why he gets along okay in prison, because he didn't come from a privileged background.
Now, Christy, you go to visit him in prison. Currently, the Bureau of Prisons is investigating him for allegedly having a contraband mobile phone to run his business. What has he told you about that?
I'm not going to answer questions about contraband that prisoners may or may not have. Personally, as a journalist, if I interact with prisoners, unless they're presenting some sort of public safety issue, I just have no interest in casting any kind of aspersion that might make their lives more difficult in prison.
You'd like
Prison's
to plead the
already
fifth as well,
pretty
would you?
terrible.
Okay, fair enough. But fair enough. But let me ask you something. His ambition to come out and be richer than ever, that is true, right?
That is true, yes.
Fair enough. Let me quickly just go over to Josh for one more question before we leave. Josh, I understand you keep an eye on Martin Shkreli's blog, that he somehow gets out of prison. Is that right?
Yeah, he does. It's really interesting. He writes a lot about medical journals and articles that he's reading, and then shares that with a large community of people that have kind of started to follow him. And it shows, I think, how intelligent he is, but also how much he actually cares about it.
Thank you, Josh. You get the last word there. That's Josh Robbins in Nashville, and Bethany McLean and Christy Smythe, thank you also. And thank you at home for watching. That's all we have time for. If you want to see this episode or any of our others, please check out our YouTube channel. Till next week, goodbye.